Okay, just tell me your name, please.
My name is Larry Morris. I got a second chance to life. I was admitted probably back in 2013. I was brought in by ambulance. I was unconscious and admitted to the ICU unit here. And doing their diagnosis, they came up with the fact that I had multiple myeloma, prostate cancer, DVT blood clot on my right lung, and thrombosis in my left and right leg, which is another sign of blood clot, I think, yeah. When you speak in reference to cancer, most people think the Sarah Cannon Center and other sites possibly in the city are usually the key places to go, but I found out firsthand that in this little cubicle here at Nashville General Hospital that they have some of the best scientists in the business.
People feel like it's the hospital of last resort, and if you look at our phenomenal success with cancer care, our new designation is a Diabetes Center for Excellence. If you look at the amazing results that we have in care management with hypertensive and diabetic patients, if you look at the number of women who have gone through no-cost mammographies with Mammos in May, we're really a place for help and delivering hope for those who really need hope when there is none anywhere else available.
It's hard to imagine Nashville without Nashville General Hospital. It's really hard to imagine that we have special programs that reaches out to the community, that shows each individual that they are important, that their lives are worth living. And so without a hospital of that nature, of that magnitude, I can't imagine life without Nashville General Hospital. I really can't.
One of the reasons that I've always had a passion for General Hospital was it wasn't long after I started working here and we had an elderly gentleman that come in by ambulance with abdominal pain. And so when I went in the room to do his assessment, he started crying and he said, "I'm really embarrassed." And I said, "Why are you embarrassed?" He said, "Because I lied." He said, "I don't have abdominal pain." He said, "I'm about to starve to death." He said, "This month I had a choice either to buy my medicine or food, and I bought my medicine." He said, "So I haven't eaten in 3 days." So the night shift that night, we all chipped in together and went downstairs and we got him food so he could have something to eat. And then we pitched in some money to get him some groceries. The way we all pulled together to meet this patient's needs, that was really a memorable moment for me, and one of the reasons I have probably stayed here at General Hospital for the last 18 years.
You know, we have people that has no income or low income, and it's very good for that reason. You know, we need this. This is what we need, because otherwise we couldn't afford to go other places. I can't.
We all in this space have health care, and so we don't know what it's like not to have health care and probably can't even fathom what that means. But there are lots of people in this city, over 100,000, that either have no health care or are underinsured, and so to consider having those people try and figure out what they need to do or just use the emergency departments to an extent where they're overburdened just makes no sense to me.
I've been asked from people in the community why they should give to the foundation to support our patients when we do get an allocation from Metro government in support of the hospital. And it's a good question. And while that is a dollar for dollar support for our patients, it's very targeted, and it doesn't do everything that our patients need. So when you look at the things that the foundation dollars do, which is supporting the cancer patient rent or providing the food pharmacy, it's going beyond the Metro dollars. So while the Metro allocation is essential for our hospital, community support and that public-private partnership is also essential towards our growing success.
Just addressing the current perception of the community towards Nashville General Hospital, you know, we'll always have individuals in our community who will not have the ability to afford health care. And health care in the United States is not a right. In most industrialized countries, it is. It happens not to be in the United States. So there will always be those individuals who will need it, and we should not view the lack of health care ability in an individual as something that is pejorative or that is negative or that is derogatory. We should view that as we should all have an inherent right to health care. And for those who don't, we have hospitals and cities such as Nashville that are providing what is commonly referred to as safety net hospitals to provide that service. That simply means that an individual should not have to suffer simply because they do not have the funds or the resources to afford health care.